Monday, Monday, Monday. Hey. Monday, Monday, Monday. Monday, Monday. Monday. Monday, Monday. Monday. Monday, Monday, Monday. Manga, manga, Monday. Manga, manga. Like to be manga, manga? Don't tickle. Done.
Jai Shri Krishna, Jai Shri Ram, Jai Shri Lakshmi Nrsimha. So now we are going to discuss about the femur bone. It is the strongest bone and also the longest bone in our body. So the reason why it's the strongest bone it actually has a very powerful head, and the shaft is very powerful. It's massive in size and supports the thigh, and it basically plays a very important role in weight transmission.
Hiya, which is the longest bone in the body?
The femur. Alright, now explain Abhigya. So this is a complete analysis of the femur bone, and let us see the femur bone and its head now. Its head is somewhat medial, so you can see it is curved towards the medial place. Stop laughing, Abhigya. So it's curved towards the medial direction. You can see it's somewhat like this. So the bone is like this, the head is like this. So this is how it is. And the bone is somewhat like this, but very straight, like this. The head is pointing medially and upwards. It is upwards and medial. This is the position of the head. This is the point where the head articulates with the acetabulum completely, this full area. I've only marked this much, but it's from here to here. So the acetabulum is a gap formed by
What does medial mean, Bhaiya?
Medial means towards the body. So here is the area which articulates with the acetabulum. The acetabulum is the hip area. It
Bhaiya, can you move your hand?
joins with the hip.
Yeah.
So the hip basically has many portions, and of those portions the acetabulum is a circular portion in the center, and that portion articulates with this one, the head, and the head is basically covered with articular cartilage, and this forms the hip joint. So now we're going to see the neck of the femur. It's here. So before we proceed to the neck, I'm going to ask my sister some questions. To which direction does the femur bone's head resemble? Like, which direction does it go towards?
Medial,
What does medial mean?
towards the body.
Right. So with what bone does the femur head articulate with?
Patella?
The head, the lower end articulates with patella, the head articulates with acetabulum. Acetabulum is a circular gap made by the hip bones. So now we should go to the neck of the femur. The neck of the femur is 5 centimeter long, and it connects the head to the shaft. So basically this portion is the neck. What you see here is basically more than a globe. More than half of a globe, of a sphere. So basically the down portion is the only portion that is exempt from the sphere. And next we shall see that the head is connected to the shaft through the through the femoral neck. So the neck basically is connected to the shaft and connects the shaft to the head. And it has an upper and lower area. So we can make difference between the two. You have trochanters on both sides, a greater trochanter and a lower trochanter. So basically the head is connected to the neck. Of course the head is connected to the neck, but in the femur the shaft is connected by the neck to the head. So this is the way it is. And the angle of the neck and the head in the femur, not this neck and head, this head and neck, this angle that you can see here, it is like this. The head is pointing medially, whereas the neck is somewhat straight. So the angle, this angle is called the angle of femoral torsion, and that is around 15 degrees.
Just like your head.
Okay, so now this is another angle that I'm talking about now, is a femoral angle, it's not the torsion angle, it is a different angle that I'm talking about. This is connecting to the acetabulum. So this is more acute in females, and an adult has it as 125 degrees, whereas a child would have it as 165 degrees. So this is how the neck is. And the next one is this, this angle basically assists in the swinging of the body, swinging of the lower body from the pelvis. So basically it can just swing. It doesn't need the support of the hip. It needs the support of the hip, but it can just swing because the lower body can move and doesn't need the constriction of the hip there. So what is the neck, Abhigya, of the femur? Femur?
Can you tell?
Okay, what is the neck of the femur?
It's the neck of the femur.
The neck of the femur is between the shaft and the head. So this area is the neck, and this area which points upwards and is larger and is quadrangular is called the greater trochanter. The one that points downwards is called the lower trochanter. So this is how it is. And the next thing is that this bone has a posterior surface and an anterior surface. The posterior surface is, the anterior surface is quite flat, whereas the posterior surface has some, some changes in it. And the anterior
What is
surface,
anterior and posterior, Bhaiya?
anterior is facing towards front of the body, whereas posterior is behind the body. So, for example, if I stand like this, then this is the anterior. This is the anatomical position. It's the anterior. This is the posterior. Okay. This is flexion. This is extension. So there are various movements. Now, I'm going to explain the anterior surface. The anterior surface is flat and it's entirely intracapsular, and it meets the shaft with the it's called the intertrochanteric line. So you have this intertrochanteric line here. It's here. So it meets the shaft here. So that's how it is, the anterior surface. And the posterior surface is somewhat convex from above. If you see from above, it's convex. And downwards, above downwards. So if you see from up and out, it's convex. So and meets this area also, the anterior surface, through that line, as I said. So the next part is an intertrochanteric line is a prominent ridge seen clearly. So you can see it very clearly. The intertrochanteric line is here. I have not marked it very clearly here, but it's a ridge. This thing, it's a ridge.
Just 1 second. I'll bring it forward and show.
What is the intertrochanteric line over there?
It's there somewhere close to the head and neck.
Yes, and what is it? Is it a hole?
Kind of. Just a bend.
No. It is just a ridge, a line, a rough line.
Okay.
Okay. So now there's a shaft. Now the shaft I've explained here. Okay. So these are the two ends of the shaft, and this is the superior end. This is the inferior end. So the next portion I'm going to explain is the shaft. The shaft has 3 parts. The upper 1/3, we're going to make the shaft into 3 parts. Upper 1/3, which is connecting to the head, and middle 1/3, which is pure to the shaft, and the lower 1/3, which is connected to the condyles, or the inferior part of the femur. Now we will see the shaft and its clear explanation. Here is the upper 1/3, middle 1/3, and lower 1/3. Abhigya, so can you please tell me the upper 1/3, middle 1/3, and lower 1/3 and their relations?
Upper 1/3 is in the head and the neck of the femur, and the middle 1/3 is...
Upper 1/3 connects the head and neck to the femur.
Yeah, okay.
Correct.
And middle 1/3 is there in the middle. It's in the middle of the shaft.
Very good.
And the lower 1/3 is in the lower end of the femur.
Okay, so what does the lower 1/3 connect to?
That connects to the patella knee bone.
It connects to the condyles, which connect to the patella. Very correct. So that is good. And now the middle 1/3 has 3 borders: lateral, posterior, and medial. So lateral and medial are not very clearly seen. whereas the posterior border is called the linea aspera. So if you see the posterior surface of the bone, you see a long ridge-like sharp border, a sharp line.
What is lateral, Bhaiya?
Lateral is away from the body on the left or right side. Medial is towards the body, and the posterior is behind, as I explained before. So the posterior border is very sharp. You can see it very clearly in the posterior surface, posterior view. So the linea aspera has two lips, medial and lateral lips, like this. They call it the lip. So as we come up, we have a gluteal tuberosity. Gluteal is a region close to the buttocks.
Where is the lip?
Lip is not this lip. Lip in femur is the lateral and medial sides of the posterior sharp border. Lip. Medial, lateral.
Can you show it in the image of the femur?
Okay. So here is the lateral lip. Here, here is the lateral lip. Here is the medial lip. So if you want to know where is the medial side, see where the femur bone is pointing towards. This is the medial lip. This is the lateral lip, and here comes the line. I have to show you the posterior surface to clearly explain this, not the superior. Not the anterior one. The anterior one is quite flat. The posterior one shows the fossa here. This is called the interior condyle fossa. So you know it's posterior. Now this is the border, and here is the medial lip. Here is the lateral lip. So now I shall explain the gluteal tuberosity. The gluteal tuberosity is at somewhat close to the head, and that is at the area behind the buttocks. So that's the place, just behind the buttocks. Now the spiral line is pointing upwards, whereas the linea aspera is pointing below, and the gluteal tuberosity is up. So it is somewhat like a tubercle, and this is how it is posited basically. Now this one is another type. Now I'm going to explain the lateral supracondylar line and the medial supracondylar line. We are seeing the lower 1/3 of the shaft. So lower 1/3 of the shaft ends with the adductor tubercle here, and the medial supracondylar line comes there. So this is the medial surface. You can see it comes from here to here. This is the lateral surface. It comes from here to here and ends here. So this is how it looks. The upper 1/3 is defined clearly. The medial and low 1/3 is between the medial border. This is the medial border, and there's a medial supracondylar line. So it's between these two. Now we have understood the different surfaces. The anterior surface is ill-defined, not exactly defined, doesn't have an exact area. The lateral surface is between lateral and posterior borders. You have this border, the lateral border, this is a posterior border. So this is called the lateral surface. And the medial surface is medial and posterior border. This portion is the medial surface, and the upper 1/3 is well defined, whereas the low 1/3 has to be identified by seeing the medial supracondylar line that's on this area medially, the last line of it, and the posterior and the medial border of the posterior linea aspera. So the center in the middle is called the medial surface. Abhigya, what is linea aspera? The linea aspera is a tough ridge in the center, a long tough ridge. So what are condyles, Abhigya?
Condyles are there in the lower end, and those are the ones here.
Okay. So listen to me clearly. I'm going to ask you some other questions now. Now I shall explain the posterior surface. And now let's again see the anterior surface, anterior aspect. Here is the articulation with the acetabulum, this pink surface. This is the head, this is the neck, this is the upper side of the neck, this is the lower side of the neck. This is the greater trochanter pointing up, this is quadrangular. The lower trochanter pointing down, somewhat triangular. Now here is the head, and now we shall see the shaft. Shaft is already explained. Now the inferior area. So this is called the adductor tubercle. This is the medial epicondyle, this is the medial condyle. This is the lateral condyle, this is the lateral epicondyle. This is how it looks. Now let's see the posterior aspect. This is the head in the posterior side. Just turn the bone around. And this is the greater trochanter. Everything turns. Greater trochanter. and it's quadrangular as seen clearly. There's the intertrochanter crest as I explained, that line, and this is the spiral line, the long linea aspera, and the upper part of it is called the spiral line, gluteal tuberosity, and this is supracondylar line over here, this portion, and this is the medial condyle, this is lateral condyle, and there's a small fossa in the center. This is more towards the lateral condyle. It supports the lateral condyle. It's a fossa means a depressed area. What does fossa mean, Abhigya?
A depressed area.
Okay, where do you find the fossa in the femur? Here is the femur.
Okay, I don't know that.
I said that the fossa is in the center of the inferior area between the two condyles. You explained the two condyles, is it?
Yeah.
So it's right in the center, like this. Now you have the two condyles here, and here the black surface is towards the lateral condyle. That is called the fossa. It's a pit type of place. Now this fossa is more towards the lateral condyle and lesser towards the medial condyle. And the lateral condyle is smaller but it's stronger. The medial this is lateral condyle. The medial condyle is larger but it's quite weak. So the medial condyle is like this, but not too protruding outside as I've drawn here. It is quite protruding. This is the intercondylar fossa. And now we should see the next portion. This is a ridge. It's smooth and round. Intertrochanter crest. It's smooth and round. This is the anterior. Okay, we have seen the shaft already. And the medial condyle has two parts, medial condyle and medial epicondyle. Lateral condyle has two parts, lateral condyle and lateral epicondyle.
Bhaiya, you said that the ridge was rough.
That was the intertrochanter, that was the linea aspera, whereas this is intertrochanter crest. It's not a ridge, but every ridge is not rough. Linea aspera was a ridge that was rough, so I said rough. So ridge is just a line, just a marking line. So if the marking line is rough, it's a rough ridge. If the marking line is smooth, it's a smooth ridge. So next we are going to see that the lateral condyle is stronger but it's smaller. This is how it is. And these two condyles are quite powerful, with the lateral condyle being very powerful. And now the patella is basically on the anterior surface, like this, cupping on top of it. Now I should explain how the articular surfaces are present. Articular surface means an area where a bone is attached to another bone or cartilage or any other area. So anything that joins with any other thing is called articulation in anatomy. Now this articulation, you can see the circle I put here. This is basically the marking of the anterior surface of the patella, which is connected to the anterior surface of the two condyles. And now we shall see the tibial surface. This covers the inferior and posterior surface of both the condyles. Now the anterior surface, the front area is covered by the patella, the back area and the lower area, posterior and inferior, is covered by the tibia. So now can you tell me, Abhigya, what are the articular surfaces of the femur?
What does the articular surface mean, Bhaiya?
Articular surface, I right now explained that anything that joins with anything at a particular area in anatomy is called the articular surface.
Okay, patellar surface and the tibial surface.
Okay, now tell me, where is the patellar surface located and which side?
Patellar surface is located in the
Front, back, or lower or higher?
front and higher.
Correct. Very correct. Now, where is the tibial surface located?
Tibial surface is located in the low and the back.
Correct. So, tibial surface continues anteriorly with the patellar surface and is separated posteriorly by intercondylar fossa. So it actually continues like this, but at the back side it's separated by the fossa, this fossa that is present here. Now the part over the lateral condyle is short and straight, whereas the part over the medial condyle is longer and curved. So this is how it is. And the intercondylar fossa or notch, this is how it is, somewhat like this. You can see it here, the black surface. It's not a surface, it's somewhat like a pit. So here is medially towards the body. Okay, now I shall explain the anatomical position of the femur. The femur is held straight, little bit this way, but it's actually held straight. Yeah, like this. It is held straight in its long axis, not like this, but like this. This is the position of the femur. It's held in its long axis. There's a head one I'm showing up here. Now basically this is held vertically like this, superiorly inferior, and it's slightly oblique, little bit oblique. It's directed upwards and medial. And basically if somebody shows the posterior side or asks you to identify the anterior or posterior surface, check the fossa. If the fossa is present at any point, if you're able to see the fossa, it means that's the posterior side. The anterior side will not have a visible fossa. That's how to recognize the posterior side. So the convex border is anterior and the sharp border is posterior. Sorry, I just mentioned it's a little bit convex and the sharp border is posterior. So this is how it is, and this is how the bone is present. So the next thing would be to recognize the femur bone and see its image, which I should open now in my book. 1 second. So here is the femur.
Bhaiya, can you show me? Okay.
So you can see how the femur, this is the anterior one, this is the posterior one.
This is the anterior one?
Yes, this is the anterior one. Can you focus on the words over there?
Yeah, okay.
So that's the neck, that's the shaft, and these are the condyles. Whereas there's a posterior one, that's the head. You see it's more than half of a sphere. And as it goes down, you can see the other parts, linea, aspera, two condyles and epicondyles. That's how it is. So, thank you. Jai Shri Ram, Jai Shri Krishna, Jai Shri Lakshmi Nrsimha. Our grandfather had a fracture in the femur bone. It was at this point and a fragment came out of the area. It is the neck of the femur bone between the greater trochanter and the lesser trochanter, somewhere there, and more towards the greater trochanter.
Wasn't it a hairline fracture, Bhaiya?
Yeah, it was a hairline fracture, and it was lateral to the intertrochanteric line. So you can describe a fracture that way. So we did a study on his x-ray and we cured him at home without even consulting a doctor. Turmeric, etc. were administered, and today he's walking quite
With
well.
Pirandai?
Yeah, and Pirandai, and the first few days was turmeric. And yeah, basically that herb is called the adamant plant, adamant plant.
Creeper.
So, yeah,
Creeper.
Sorry, creeper. Adamant creeper. It is basically somewhat it's quadrangular and it's filled with fluid inside. This
And
is
also
very
has
good.
small leaves.
And its botanical name is called Cissus quadrangularis. And that plant was administered, but in the beginning we actually gave only turmeric and milk. And turmeric, of course, is the greatest herb for joining bones. So we gave high quantities of turmeric.
And later we
And
started
that's
adding Pirandai powder in rasam and all of those dishes.
So there were other herbs also being used like aloe vera, etc. to give smooth texture and a good texture to the herbs, and
Yes,
this
with
provided
mainly leaves
very good things.
and
And
amla.
that is to set right the liver, that's it.
Yeah.
So setting right the bones was with milk, because milk contains calcium, curd contains calcium too. So calcium with turmeric, milk with turmeric.
And
is
that
the best.
was milk of indigenous cows.
Yeah, and also turmeric is basically containing a compound called curcumin, and curcumin is a very important compound in curing fractures, and a spoon of turmeric would contain a high quantity of curcumin. That's around 1/4 of the spoon would be curcumin. Sorry, 1/8 of the spoon would be curcumin, and that's very important for healing bone fractures. So if anybody has a fracture, you can try this method. So basically, anatomical understanding is absolutely necessary to cure a patient, because we need to see the exact position and need to administer, etc. And especially for surgery, etc., anatomy is absolutely vital and necessary. So that's why even in Ayurveda, people study anatomy to get a good hold of the subject and to be able to grasp everything quite clear. Even the ancient Hindus and ancient Ayurveda experts used to study anatomy, so it's a very important thing. Thank you. Jai Shri Ram, Jai Shri Krishna, Jai Shri Lakshmi Narasimha.